morning, ladies. How are you guys? So, if you had seen my first IVF journey video, you know by now that my first IVF failed. And yesterday I went for my consult with my doctor, and I had a plan to really let him have it when I got there, but I think that he must have already read my mind, because when I got there, he pretty much had everything all mapped out as to what he wanted to do differently with this next cycle. Last cycle, they didn't call me in until day 6 of my cycle. This cycle, they're going to call me in day 2 of my cycle instead of coming in 6 days later. I'm coming in the next day after I start my cycle. The Ganorex that they were giving me to stop ovulation, they're going to start that with my stems so that they can immediately stop ovulation at the core. Now, with the last cycle, I started off with E-Trace. This cycle, he wants me to start off with birth control. So I'm going to take birth control for a week before I start the stemming. And he said that will help the follicles to all settle down. Then last cycle, they did not start to monitor me until day 5 of the stems. He's going to start monitoring me on day 3 of my stems. So he had already had it mapped out that everything was going to be done early. Since I am an early ovulator, they don't want history repeating itself. I actually spoke to the embryologist because I was just curious as to how many of the 5 eggs that they retrieved were actually mature. And the embryologist told me there were 3 eggs that were mature, and all 3 of them fertilized. So it was actually 3 eggs that fertilized, not 2. However, one of the eggs was a 3PN, and the other 2 eggs is a 2PN. 2PN is normal. 3PN and 1PN is abnormal. And I didn't know what a 3PN was, but he told me the one that was a 3PN, they just didn't even move forward with that one at all. And I went to look it up to see what that meant, and apparently that means that 2 sperm got into the egg at the same time, causing 3 different DNA or something. I don't know what it was, but it caused 3 different nuclei or something, because it was 1 female and 2 males instead of 1 male and 1 female. That's 2. When you got 1 plus 2, that's 3. So that was not going to be a valuable egg, so they didn't even bother with that one. And he said the other 2 was fully matured, and they had he said they looked good to them, but after the 3rd day they had stopped growing. So yeah, I'm a little disappointed, but I also know that there's also an age factor here. You know, I did a lot of research on trying to go through this journey at my age, and as I've stated in videos prior, I would have had a better success of conceiving if I would have did it naturally versus going through any type of fertility treatments, because number one, sometimes the drugs that we take at this age does more harm than they do good. And number two, when you get over the age of 40 years old, you start producing more bad quality eggs than good quality eggs. So if you're naturally trying to conceive, eventually one of those months the sperm is going to meet up with that one good quality egg. You know, when you're going through the IVF cycle, it's like gambling, you know. And once you get to the age of 45, it's a real big gamble, more like a needle in a haystack, because you really have no viable good quality eggs left. And no matter how hard that I work to try to improve egg quality, I may get lucked up on one or two. And the question is, with me skipping cycles and, you know, all the stuff that, you know, went wrong during this whole process, who knows if I already ovulated that one or two good quality eggs. So I've decided I'm not going to move forward after this next cycle. This will be my last IVF cycle or any type of fertility treatment using my own eggs. This will be my final one. I get 4 retrievers per year paid by my insurance company. I had already planned to only use 2. The first one, you know, I knew that was a gamble, but I went forward with it anyway. I'm not, you know, disappointed that I didn't do it, that I did go through with it. You know, I'm kind of glad that I did. So now it's all about producing more eggs at the same rate, and hopefully being able to pull more eggs out. Now, when I went to my consult yesterday, I didn't know he was going to be giving me a ultrasound, and the ultrasound showed that my ovaries have not settled down yet. The ovaries are still enlarged. The follicle sacs are still enlarged. And this week, I was expecting my cycle. So far, it have not came, but the doctor is glad it has not come, because he stated if my ovaries and my follicle sacs are still the same size that it is now, and by the time, you know, my period get here, they would not be able to move forward with the IVF treatment, because they have to have my ovaries and follicles back down to normal size. So he wanted me to do a little bed rest as much as I can when I'm not at work. Not do anything strenuous, no exercise or anything. You know, use a heat pad, help bring it down. He's expecting my cycle will be delayed because of the retrieval, so I should be getting it next week, and hopefully that happens, and hopefully by then the ovaries have been settled down. It's only been 1 week since the retrieval, so this is normal according to the nurse. But another thing too, the embryology department is shutting down for a week or 2 weeks actually, the 3rd week of December into the 1st week of January. And anybody that's doing any IVF cycles, they have to start their stem by December the 3rd. Nobody that doesn't start their stems by December the 3rd, they will have to wait till January. So if I end up passing up this cycle because my ovaries are not settled down, I have to wait till January to get started. So again, the further I go past the age 45, the lesser my chances are. So right now, I'm at just about a 0.5% chance, like a 0.5%, not even a 1%, a 0.5% chance. So, but I don't have nobody to blame but myself, because had I not waited this long to try to conceive on my own, this would have never happened. And, you know, so anyway, we're gonna get this one more shot. If it does not work, then I'm moving on to donor. I'm all prepared for that. And I guess I'll keep you guys updated and let you know when my cycle come down, if I'm going to be able to move forward with this IVF, you know, based on if my ovaries and my follicles have settled down. So, until next time, enjoy your day, ladies. Bye.